Hello everyone and welcome back to Physiotrendz. And this week Physioquest question was a little bit different because it was based on the real case. Now talking about the real case, all of your observation is very nice, so congratulations to all of you. But some informations have been missed out and on which I am going to focus on the answer of this question. So let's begin with the question first. The question information what we have got, it shows that patient has some imbalance. Patient's chief complaint is that patient is having imbalance, especially while performing sit to stand activity, and that is not just sit to stand on the chair, but it is like sitting on the floor and coming up. Second information which is mentioned in this is there is no developmental delay or there is no involvement of brain in this case, so that we can think of like any brain related issues which creates imbalance. One more thing you must have noticed that we can also not think of vertigo, because vertigo comes because of particular one situation or particular one position maintained by the patient. Like for example, some patients have tilting of the head on the left side and then they get started with the vertigo symptoms. But this is not the case over here. Patient has chief complaint of only that patient when performing sit to stand activity, that time patient is having imbalance. So that also can be ruled out easily with this information. Another information given to us is that dorsiflexion or ankle mobility is limited, and that again x-ray was given with the question in which it is shown clearly. Most of you have told yes, definitely it is a plantar fasciitis, definitely we can see a navicular bone dropping a little bit. But one more main important thing which all of you have missed out is starting of calcification of the plantar fascia, that we can see here on the plantar fascia, what the white lines what we are seeing, that is because of the calcification. Now we have studied this in the biomechanics of the ankle and foot. What is the importance of plantar fascia? It is like a tie rod. So if you are stretching your plantar fascia, what will happen? Automatically the arches, longitudinal arches of the foot comes down, it brings it down, right? And that is what has occurred over here, and because of that we can see that navicular bone is coming down. One more important thing in arches of foot, we can notice that longitudinal arch, the main point, key point is considered as talus bone. And if it is a transverse arch, the key point is considered as metatarsal bone. So here the longitudinal arch is compromised, and because of that we can see the position of the talus, and along with that calcaneus navicular is also compromised, and that is why we can see a flat foot appearance, and that again keeps the foot in pronated situation. Because when it comes to ankle mobility, we have to talk in triplanar movement, which is either supination or pronation. Here the foot goes in the pronation. We can clearly see that there is plantar flexion, eversion and abduction of the foot, and because of which here you can notice that when patient is walking, we can see if the patient walks with more of the external rotation on the both the foot, and also we can see limited knee extension, that is again because of calf muscle are very tight, hamstring muscle is very tight, which is not allowing ankle to go for more of the dorsiflexion, as well as not allowing knee joint to go for more knee extension. So these are the problems that we can see from the x-ray and from the observation of the patient. Now let's come back to the original, which is like the complaint of the patient, which is sit to stand imbalance is present. Now what exactly goes wrong over here? Because of the lack of ankle mobility, we can see that when patient tries to go down, ankle is not moving for the dorsiflexion, because of which patient has to shift the LOG more in the forward direction. Now this is a very important thing from the biomechanics point of view. You should know that LOG, if it crosses the base of support, it is going to create imbalance for the patient, and that is what happens with the patient. And because of which patient, when patient tries to go more down, they completely lose the balance, and it seems to be like they are falling down. So that is a problem, my dear, and the solution of this is very simple. Now this case is why it is so much important, because this patient has roamed for 1 year for this problem with the orthopedicians, neurosurgeons, everyone. They have undergone, the patient has undergone MRI for spine, MRI for brain, MRI for ankle, foot, everything they have done, but nobody could identify this problem. And here comes the physiotherapist who can identify this problem because of the biomechanics knowledge. And that is why, my dear friends, I really say to all of you that please focus on the biomechanics and basics of biomechanics. Alright, let's get back to this. So now, as I told you, what happens, LOG falls little bit anterior more from the base of support, patient falls down. So to control this, we have to work on the posterior chain of the patient. Posterior chain includes your back extensor muscles, gluteus maximus, hamstring muscle and calf muscle. So here first we need to work on the ankle mobility. To improve dorsiflexion, we have to stretch calf muscle as well as hamstring muscle. Once that is done, we have to work on strengthening component of the gluteus maximus as well as back extensors, so that we can create a balance over here, and then we can ask the patient to perform this functional activities. Actually, in the clinical scenario, we can train the person to do this activity with improving ankle mobility and with improving strength of the certain muscles, and then we can get this patient back to the normal position. So I really hope, guys, that this was very useful for you. This case discussion was very useful, and don't worry, I'll be posting more videos about this case as the case progresses, so that you will be able to see the progress of the case as well. And meanwhile, don't forget, this Physioquest series is very much important for all of us to learn these clinical scenarios. And if you want to learn more cases like this, I have Physioquest 1 series where I have shared more than 30 questions, as well as Physioquest 2 series, 4 questions are already over. Links I'll be providing down in the description. So just go and watch them, and you will learn many new things which you didn't know about the clinical scenario. And also don't forget to subscribe Physiotrendz and follow Physiotrendz on the Instagram.